Welcome to AUA Leadership in Business, an official podcast of the American Urological Association.
Welcome to the AUA Leadership in Business podcast, where urologic professionals experience the practical applications of business acumen, essential for success in today's dynamic professional landscape. I am Steve Riggs, and in today's episode, we welcome Dr. Lisa Bailey to discuss navigating through the realization that your career is no longer serving you. Dr. Bailey practiced as a urologist for 6 years after finishing a urology residency in 2017. She served in both private practice and academics, and then ultimately made the decision to leave urology and eventually clinical medicine. She briefly practiced in the field of wound care before moving to utilization review and management, currently with Evolent Health. Dr. Bailey, I'd like to welcome you to our podcast today. I would like to first prompt the audience a little bit to tell you how excited I am to have Dr. Bailey. I think you're going to find her story full of humility, vulnerability, with a heavy dose of resiliency. And I also look forward to hearing from many of you as you think through how to unpack this in your own lives and own experiences. So again, I welcome Dr. Bailey.
Yeah, thank you so much for having me. This is a great opportunity.
So I'd like to kind of frame this for our listeners and start out by why you chose urology and kind of help me understand how you got to where you are.
Yeah, so when I was in med school, I did an elective in urology, and I really think that I just really enjoyed working with the people there in the program. They just seemed friendly and nice and good sense of humor, as a lot of urologists tend to have. And I just thought, this is, a group of folks I could work with, and I sort of identified with them. And so that piqued my interest. I also had a couple of friends who went into it who really liked it. And I, kind of trusted their opinion on that too. So after the 4-week rotation in third year, I decided to go ahead and pursue it. I liked the idea of doing procedures and surgery and then also having that clinical long-term relationship. A lot of candidates are going to tell you that same thing. It was kind of the same reason as everybody else. I was told it was a good lifestyle, all that stuff. And then, I also liked the idea of having a bit of a challenge. It was a very, it's a prestigious field. It's hard to get into. I like the idea of being able to sort of climb that mountain. And so that's ultimately what led me to pursue it.
So we discussed in some general terms the concept of burnout, but what I think I'm trying to understand, and maybe you can elucidate this a little bit more. Do you really look at your decision to ultimately leave urology as burnout, or just a decision when you reflect back and look back? Kind of lead me through that, and then kind of what was kind of the things that really kind of got to you that said, you know what, urology is not for me.
Yeah, well, first of all, even during residency, I would kind of look around and think, everybody seems to be doing a better job. They seem to be thriving even in times of duress. It was kind of like, oh yeah, this is not, we don't enjoy this right now. But, it wasn't, I seem to be a lot more miserable than everybody else. So I noticed it even in residency. But then I did, a 4-year private practice and then about a year and a half in academics. And I would say that it was a combination of ultimately just choosing the wrong path from the get-go. And there was some burnout involved. I mean, I know we spoke about this, but it's very rare to truly love your career. I don't find a ton of people who are just raring to go every day, waking up, the birds singing and just can't wait to get to work. But I think when you combine that element of burnout with a career that you didn't quite realize at first you don't enjoy, but come to that conclusion. That's really what led to the perfect storm of me deciding I had to find a way out.
So do you think that the, when you reflect, you call it poor choice. So if we say, okay, it's not burnout, it's poor choice. Leading up to urology, do you think there's things the system could have done, urologists could have done, departments could have done to help you realize that maybe this wasn't the right choice for you from the beginning?
Yeah, I ultimately put the onus on myself. This is that you really should, maybe even before medical school, and it's hard to do because you're in your 20s, you're in maybe younger, and so it's really hard to be that reflective and introspective. But I do think that it takes a lot of reflection and personal, thought into that. So I don't ever want to come across as saying that somebody could have done a better job at getting me to that realization. That being said, it may have been a good idea. And, I don't know who's going to do this because everybody's busy. Everybody's just trying to, do the work that they already have to do. But if the program directors were a little bit more upfront and sort of interviewed the candidates and the med students, even the rotating med students, almost with an air of skepticism, and not to be off-putting, but just to make sure these people know what they're getting into. But I don't know if that's truly possible, to be honest with you. It's just none of us really know, what we're embarking on when we start, even with medical school.
So you said you had some anxiety early on, or like then the concept of like, hey, everybody else looked happy, and maybe you were starting to question, why is everybody else look happy, look like they're thriving, you're not? Then you transition it. If I'm hearing this correctly, you're out in practice. What were there specific things about being in practice that kind of drove the needle into you about, like, was it call? Was there anything else about like personal, was there things that kind of started to come together that said, okay, this is not the field for me?
Oh yeah, like all of the above. So uh, my personal private practice experience is a little unusual. I joined two other guys in a small town that really needed more than just 3 urologists. So we're very busy, which I know a lot of people look at as a perk. But I hit the ground running, and then about a year and a half in, and we were 1 in 3 call, and we were busy. I found it very difficult to adjust to that life of kind of going back almost to an intern or junior level. As a chief resident, you get to, you're not the one running all over the floor with the consults. But when you go back to a private practice setting, that's you again. You're putting in those catheters at 2 a.m. You're doing all of that stuff, and you're getting phone calls about, the stuff that some of the stuff that we used to get called about used to drive me nuts. Like, hey, can you schedule this patient in your clinic tomorrow? And, it's like 11 p.m. at night. And I'm just like, being called about this stuff in the middle of the night used to bug me. But it was also the fact that my partner had a horrible accident about a year and a half in. He had a bike accident, and he had a spinal cord injury, a C-spine injury. He was out for months. And then my other partner, who had already planned on leaving, I don't want to paint this picture as him abandoning ship, because he actually stayed later than he had planned to help us out. He wanted to go into academics. So eventually I was kind of left on an island. And my partner returned. He's able to operate now. It's kind of miraculous how he recovered. But in all of that turmoil, I was the only person taking call. I was the only person doing ER call for quite a long time. It's not what I signed up for. And then, which, that's nobody's fault, but it's just is what it is. And so that combined with the fact that I already hated call, I already hated getting, I just didn't have that mindset, like that some people just don't mind it as much. I know no one loves it, but I just saw my colleagues. I saw my husband's an ENT, and, he just didn't seem to struggle or have as much of that. it was almost morphing into bitterness at this point. And so I decided I needed to change. I reached out to my former partner. I actually became pregnant with my daughter, and decided like you can't be like every other weekend anymore, especially with my husband being 1 and 3 too. We were trying to coordinate, who was on call when, and we just had no weekends free, because even if nothing happens on call, you're tethered, right? Like you don't get to leave. So then I went over to the academic center and did about a year and a half, thought it was going to be better, had a wonderful situation. They completely coddled me there. I mean, it was, part-time, no call except every 6th weekend. My former partner was amazing and just very supportive throughout the whole thing when I told him, why I was leaving. And I just remember getting a phone call about a gunshot wound, and I had to drive 40 minutes away. I was in the middle of changing my daughter. She was on the changing table. And I was like, this isn't it. I just can't do it. So that's kind of my journey, and like the combination. There's so many factors at play that led to this like culmination and this decision. But that's kind of it in a nutshell.
Yeah. So, when I reflect back what you're telling me, you had this where you feel like you made the wrong choice. You didn't quite know what you were getting into, but you also respect a space like, how do you know? Which I think everybody in medicine, when they come out of medical school and are choosing what residency to go to, and they know, but they don't perfectly know. And maybe is there a space of opportunity for us to help people with a little bit more radical candor know what the situation may look like? Then fast forward, you've already got those doubts, and then you get into a really tough situation, right? Personal, professional, you're on call all the time. You're left, you're in 1 and 3, but then you got 2 partners that are technically step out. And then you've got a lot of personal pressures that are kind of occurring at the same time, that are then kind of all bubbling up to give you, I guess I don't want to put words in your mouth, to give you the strength to say like, enough's enough, or like, where's the kind of the final fork in the road, the straw, I think, number one. And then I think on the tail of that, where did you get the self-awareness to say, I mean, there's a lot of humility in that, a lot of like self-reflection, looking yourself in the mirror, like where, at some point you had to have some hard conversations with yourself, I'm assuming.
Yeah, the fork in the road came when my relationships with other people started to suffer. I was starting to, like I said, I started to have that bitterness that's just kind of there. It was just like us lurking, like just underneath the surface, and kind of bleeding over into my personal life. And I'm a good compartmentalizer, as a lot of people are. I can push that stuff away, but up to a certain point only, because after that my husband and I were not getting along. I didn't feel like I was giving my best self to my kid. I was constantly complaining to my friends about it. So it was just this, and truth. And I think this is where the burnout factor comes in. I was finding myself to be a little bit more abrupt in medical settings. I, no matter what, in terms of like, I have been very salty to other people in my field, like in terms of like nurses and even other doctors calling me. I will admit that. And I know anyone who's worked with me knows that there can be times where that has been an issue, but I wasn't like that with the patients. And so, cause I always did manage to keep that in the forefront, of my mind, like, this is why I'm doing this. But I started just every interaction, it was just really hard for me to, I don't know if it was like compassion fatigue, all of that stuff that you do have when you get burnout, that sort of like, almost like you're on autopilot, just almost in survival mode. And so that I noticed, and I noticed myself being more brusque and just not as compassionate as I had been. And I thought, this is not, there could be a point on the road, if I don't change things, where I make a bad decision for a patient, or I get more emotional in a place where it's inappropriate. I don't know, just to where if you let things fester for so long, they really, you lose control over it up to a certain point. So that started to worry me. That's kind of where I thought, you have to make a move here. But yeah, I don't remember. You mentioned there was a 2-part question. What was the other
Yeah, I
one?
was just, at some level, I mean, you changed your situation. You at least interpreted that even within the new situation, there was factors out of your control or feelings out of your control. And I think what I was trying to get to, or at least trying to understand for the listeners, where in that, I mean, that requires a heavy dose of self-awareness, introspection, asking yourself a lot of hard questions, right? About where you are, where you're going. And I was just asking you to comment on that.
Oh yeah, yeah. So that does take a lot of um you can continue to do what you're doing because you always think of it as, oh, well, it's better to be with the devil, than the devil you don't. Uncertainty is always a factor. That whole feeling of I've put so much into this, but ultimately it boils down to kind of releasing, for me, releasing my ego a little bit, because really that was what got me into this whole thing. Because I did want to do something impressive. I wanted to do it. Annoyed me in med school when people would look at me with this sort of skepticism when I said I wanted to do urology. Like it was always, oh, that's really hard, right? That's hard to get into. It used to bug me. And so I thought, well, yeah, I can do this. So that it was ultimately that got me into the whole mess, was that I was a little bit arrogant, and that was what I was trying to serve. And so once I let go of that, I mean, because I'll tell you this, nothing's a better combatant to ego than doing wound care. Wound care is a field where you have to have humility to even do it. And so this was something I did have to let go of and had to like reconcile internally, for sure. And it wasn't as hard because at that point I was so desperate. I was like, I have to get out of this situation. This is bad for me. This is unhealthy at this point. So it was almost a feeling, or it was really that I didn't have any other choice. I mean, at that point, my back was against the wall. I was like, this is it. I got to do something different. I don't care what it is at this point.
I love the framing, about your ego and about how maybe that contributed. And certainly one of my favorite sayings is your ego is not your amigo. And it does tend to ring true here, but also the concept of we're in a competitive subspecialty, and what components are driving some people's choices to the achievement of getting something that people tell them they can't do. And for a discussion for another day, thinking about what that may contribute, because in many ways you are telling me like that was part of the issue here was, hey, I can't do it. It's hard to do. Don't tell me I can't do it. I do hard things.
Right. Exactly. Yeah. I mean, unfortunately, that I think was underlying. I don't know that I recognized it fully at the time. But yeah.
Did you ever consider something short of going into wound care or to getting out of clinical medicine, like a sabbatical? Like, did you process your choices? And like, hey, I could do this or that, or at that point, was it just like, I got to get out of urology, but I still need to use my degree and my training?
Yes. So the problem with, it's kind of like, what else can you do? We have a highly specialized skill set, and one that less than 1% of the world population has. But on the flip side, I didn't know anything else, and I didn't know what my options were there. And it got to a tipping point where I didn't have time to sit and think about like, okay, maybe I should do sabbatical. Maybe I should try for a non-clinical job, because I was ready to go. I had to get out. If I had done a better job of listening to my inner voice a little more and saying, okay, something's up. Let me take some time. Let me reflect on this and figure out what I want, what else I could do. But it was I don't want to say it was a rash decision, because it wasn't. It was the right decision. And it was something I would tell my husband like every couple of weeks, like, I can't do this. And he would just sit there and like, yeah, I know. Like, what else are we going to do? But yeah, I think that for some people that would have been a really good alternative. And I think if you have the the ability to do that, to like be able to do a sabbatical or take a step back, or, and even my boss at the academic hospital, he called me after I resigned. He was amazing. He still is. But he called me and said, what if I was able to offer you no call? What if I offered you just clinic patients? Do you think you'd be interested in that? We could cut your pay, but you could do that. And it was just a hard no. I was so just completely used up that at that point I needed a change of scenery. In retrospect, though, it probably would have been a great idea to sort of get the landscape first before diving into wound care, because it didn't last. And I knew it wouldn't. It was something I was like, this is a way for me to earn money, use a little bit of my skill set, learn something new. Maybe I'll like it. Who knows? So it's like one more thing. I just kind of took a chance on it.
Yeah, I so much appreciate that response and the candor around that. And I guess what you articulated really well was like, okay, it looks like for you, urology, or at least correct me if I'm wrong, that you feel pretty confident urology is not the field for you. Yes?
Yes, in the clinical sense. I still really like
Got it.
learning about it. I think it's a great field. It's like, I just think there's so many fun little nuances with it. It's so vast to be so specialized, but I don't like the practice. I don't like the clinical practice.
Yeah. And then thinking through who somebody else who might be listening to this, who might be frustrated or fighting some of the same feelings about maybe the levels, like you jumped, as you said, because it just was so much, your walls were closing in, you jumped to something completely outside of urology versus the concept of, or the opportunity or possibility, like, could you take a step back, gather your thoughts, slow it down, give your time to go through, like what you did is really reflecting and a lot of self-discovery.
Yes. And I had time to do that, though. That's the gift that wound care gave me.
Yeah.
It was a very cush schedule. I had so much time to look into this stuff and take a breath. And so that's something that I've considered like a blessing that I was able to do it. But I think the right way is the way you're suggesting. I think that actually is the way to go. It's more measured, it's less emotional, and it's a way to really figure yourself out, because you're not going to find what you love or what you can do for a long time just jumping from one ship to another. I don't think that works for most cases.
Yeah, I love that advice too, and it's just continue to make me ponder again. As you can look at it as a listener who's listening might have those feelings, and a leader or somebody who might be dealing with some of those feelings, and also recognizing with a heavy dose of humility. Here's what I'm hearing you tell us: is that maybe there's a space where you love urology, but you don't love the clinical aspect of urology. And as somebody who's helping someone, can you find opportunities or assist them in finding opportunities? Because I think we both have said to each other, hey, you did a lot of training. And that's what sometimes it's hard for us to get out of our minds. Like, you did so much training in the field of urology. And I know from an outside perspective, not feeling, being emotionally attached to your story is, we tend to say that, gosh, you already did 5 years. You got to keep doing this, right? And maybe there's a space in between. And I'm just engaging in dialogue with you about that.
Definitely. That way, yeah, because that is the hardest thing to let go of, is the idea that you've worked really, even in college, to get to where you are at that point. My husband was so, he had so much trepidation about me leaving, not because he wanted to see me suffer, but because he just wanted me to be 100% sure. He's like, this could be, once you go past this bridge, it may be hard to come back, especially as the time goes on. He's like, you need to be 100% sure that this is what you want. And he's like, he would say, he's like, you're throwing your training away, what was it, like 9 years of training, including medical school. And so we got into a lot of heated discussions about that, and my family too, they would always look at me with this look of uncertainty, like, really? Are you sure? They had no idea what I'd been going through. I kept it under wraps for a lot of people, but everybody was like, oh no, she's gone off the deep end. There's something, what's going on, For me, it made the most sense ever. But yeah, it's really hard to let go of that part. And I would say that it's not the right decision for everybody. I think a sabbatical or figuring out almost like if you got to figure out what you like, but if you like research maybe or something like that, maybe get into more one of those roles in an academic where you still have maybe some clinical responsibility, but a lot less. But there are, I'm sure, other avenues. I'm sure you know this better than I do, that you could explore, but it takes time and it takes introspection, and you can't let yourself get in an extremist place before you decide that's what you're going to do, because you're not going to make it. It's everything's going to be emotional at that point.
So to slightly pivot or evolve a little bit, you are deciding to leave urology. How did you figure out what to do next?
So it was a little bit serendipitous. I had looked on LinkedIn and other job those job board, social media outlets, and had seen this wound care company. So I reached out to them, and initially they didn't have anything for me. And it's a national company, but they hire a lot of people nationwide. And what you do is you actually round at nursing facilities, like nursing homes, basically, or skilled nursing facilities. You see these patients once a week. You go back, you can do procedures. I mean, you do a lot of debriding and things like that, or wound vac or whatever. But basically they called me back and said, "Hey, we've got something if you're interested." And I was like, absolutely. And this so funny. I talk about it a little bit, or I think about it like the way that, you've done so many interviews up to this point, right? You've done your college and med school interviews, you've done your residency interviews and your job. This was one of the most important interviews of my life, was this wound care interview. If I didn't get this, then hope was lost, at least for the time being, unless I just wanted to not work. And that's never been an option for me. I've always wanted to work. So I did the interview, I got in, and gave him my 6 weeks notice a few weeks later. And frankly, even though Brian, my husband, he was not super on board, I was like, this is happening. I mean, I'm sorry. This is going to be something that, you'll see how much better it's going to be after I do it. And he now, in retrospect, we're both so glad I did it. But I just took the plunge. I knew it wasn't like I said, within a few months, I knew. I was like, this isn't it either. I need to take a break from patient interactions in general. That was really something that I just didn't want to do anymore. And then that was a big struggle, honestly, just to kind of segue into looking for other jobs in general that are outside of clinical medicine. There's this whole world of non-clinical careers and how to get into that kind of stuff. And there are a million options, but I'll tell you this came just as a surprise to me. They're very competitive. There are lots of physicians who are looking for these roles. And I'm talking hundreds of applicants, every job you apply to. So that was eye-opening for me, to go into that world, to learn how to do a resume. Nobody wants your CV. Like, they don't care about your CV. They want a one-pager that's curated and well done. And if and they have AI, they'll read it. And if they don't find a few keywords, you're in the discard pile for after 3 seconds. So it's very competitive.
Yeah, I find that to be a little enlightening, because I think as from our side, we're in our little box and we think, oh, if we were to be outside, we could do anything. And then what you're articulating is there's a lot of people competing in those anything spaces, a lot more competitive. I like to just touch back one thing. So why was it, I guess I'm trying to figure out why it was so important that you find another job. Did you need to, in your mind, validate your move? Like, I can do something else, or you just felt like your identity was in working? I know you said that I needed to get this job.
Yeah. So I just have never been like, that's just not how to say this delicately, because this is my personal experience and no one else's. I don't want to just be at home. I have always, that is just never something that's interested me. I did 4 months of maternity leave and I was like, when can I go back? This is something, I love my daughter with every fiber of my being. But being at home all the time is not something that is healthy for me. And so I knew that. And I knew that with like taking away a very substantial income, and then, because we're fortunate enough to have someone watch our little girl for us. And so that would no longer be an option. So then I've lost this wonderful resource, and I don't have anything to do. And I think I would just feel like I was flailing, or, in a void, if I didn't have some sort of job to keep me going and learn from, while I figured everything out. I don't know if that was the right answer, but that is why I did it.
Yeah. So as you reflect and kind of think back, I mean, what should our listeners take away? What are some of the kind of key points of wisdom you have, or at least from your perspective? And I think I just start out, I mean, in some ways, if you had to do it again, would you do it differently?
Oh, that's a great question. I think about that all the time. The answer to that, I truly don't know. There's a part so I'm a big believer in the butterfly effect, right? Like every little thing you do in life has a ripple effect to every other little thing. So if I hadn't done urology, who knows if I'd be married to the person I'm married to, or if I'd have the little girl that I have now. I have an amazing experience with urology. It's really cool that I did this for 6 years after, I operate on people. It's amazing. But it was a lot of blood, sweat, and tears involved. I had a lot of grief. And so I don't know. I don't know the answer to that. I think ultimately it's good not to regret it. And I don't know that I would change it. I may change how it went down after. I think I would probably, hopefully, have figured things out a little earlier and not suffered for as long as I did. Yeah, that's probably what I would do differently.
Do you have other thoughts when you think back that you learned, or would say, hey, in self-reflection, this is kind of what I now take away? Because there's so much just genuine sincerity in your story. And as we get to the end here, just trying to pull out maybe the precious nuggets that at least that you find in your story.
Yeah, I think that the most that I've learned, or the most important things, is you do need to know everyone has a threshold, and it's important. Adam Grant, I don't know if familiar with him. He's amazing. He's like a professional. He's a psychologist in the workplace, and he talks about quitting and the value of it. It's not always the worst thing to do. We have this stigma, this like grit that everybody who's gone through a residency of any kind knows. And, push through, keep your head down. It'll get better, just, persevere. And it's a good quality to have, but it goes awry. And knowing when it's time to fold is so important. And I don't know that it's learned, and sometimes you get it wrong, but I think that's number one. And then number two, I think, is to really know who you are and what you want. And most of us sit down and actually try to think about that or write it down, it's really difficult. And you're kind of paralyzed by it. Because I had to do that. I had a consultation with a career coach while I was in wound care. It's like, what would I even do? How do I even know what I want to do? I don't want to make this mistake over and over again. I don't want 10 careers in the next 10 years. So that's actually a really tough task. And I highly recommend that everybody sit down and kind of plot that out. Like not just what you want in career, but in life. Like over the next 10 years, what are my goals? My personal and professional goals. What do I like? What do I want to do? How do I flow? What makes me flow? What makes the time pass? What do I love? Because it's hard to nail that down for a lot of people.
What do I want and what gives me flow? Personal, professional. I love all of that.
Yeah.
You have been amazing. Thank you again for your candor, humility, vulnerability in speaking with us today, and for sharing just your time and expertise. And thank you to our audience for joining us on the A Leadership in Business podcast.
Yeah, thank y'all so much again. I want to tell you, there's an article about this I wrote coming out hopefully next month in Doximity. So look for it. It's in the op-ed section. Hopefully it'll come out. They said it would. So it kind of also talks about the same things, a little bit more prose involved, but thank you so much for having me. It's been a pleasure.
Yeah, thank you again. Until next time, continue to learn, lead, and excel. We'll see you soon.
Thank you for listening. If you enjoyed this episode, make AUA Leadership in Business your go-to podcast. Subscribe today by searching AUA Leadership in Business on your favorite podcast app and enhance your leadership and business education needs.